It was just everywhere. Within about 6 months, that's when I was sniffing it every single day.
Ketamine is fast becoming the drug of choice among young people.
You can get a gram for as little as £10, which is pocket money to most teenagers.
You take it, it's a half an hour buzz. After that, you're fine. But it doesn't always end like that.
It's a powerful anaesthetic, but spiralling recreational use is leaving some in agony.
Having to have my bladder removed at 26 years old, it's just awful.
The impact that it has on these patients is horrendous, and the age of first use is around 12 to 13 in a lot of patients, which is very frightening.
And increasing numbers are losing their lives before getting the help they needed.
She said to me that Ket can't kill your mum, and it has done, and it probably will continue doing.
The UK has a problem with rising ketamine use, and for the past few months I've been looking at how the impacts are being felt here.
This is Sophie's room. I'd never get that day out of my mind.
There's a huge increase in people using more frequently, so using daily, so we have to evolve the services that we offer.
These are the realities of a Gen Z trend that's leaving more and more young people in crisis. It's estimated the number of young adults using ketamine has more than trebled in 10 years.
It's a big rise.
And one place that's seen a sharp rise in the number of people looking for help is Lincoln. It's why the charity Crime Stoppers has launched a campaign here.
When you speak to young people, they talk about the ease of which they can get ketamine, and that ketamine for many is the drug of choice on a night out. It's cheap, it's easy to access, and because of that we needed to raise awareness of the consequences of ketamine and to try and understand what the level of use is.
On social media it is quite popular. People getting asked if they want to try it. Normally ages around this age, maybe even younger. I mean, it doesn't appeal to me, so I wouldn't know the exact reasons, but maybe because it's not seen as bad as cocaine or maybe other drugs.
In clubs and stuff, you do see it quite regularly, especially just walking around at night. You get a lot of people either asking you if you're selling it, or other people know where it is, how you can get it, if you've got any.
We need to protect our young people, and this is one of those major issues that we really need to raise awareness of.
There are growing concerns about the physical and psychological damage caused by frequent ketamine use. It can destroy lives. In less than a decade, there was a 20-fold increase in the number of deaths related to illicit ketamine.
My name's Tracy. This is my daughter Sophie. Sophie died at the age of 20 in 2024.
My name's Sarah, and this is my daughter Georgia. She passed away in June 2024.
Sarah and Tracy live just a mile apart, but their paths might never have crossed were it not for ketamine.
I've even got her pyjamas and a hot water bottle here, look. I've got a pillow made with what she was wearing last. I love to hug it and smell it, but as the days go on, its smell fades away.
Last year, Sophie Russell went to bed and didn't wake up. A sudden cardiac arrest followed months of dependence on ketamine. The drug had caused huge damage to her bladder and kidneys.
I'm grateful for my family of trying to recover from addiction.
After her death, Tracy found she documented her efforts to escape it.
I managed to save all the photographs off her phone. And looking through them, a lot of videos of her being upset, crying, pictures of her weight loss she would take herself. I found lots of scrapbooks with almost like diary of how she felt. Woke up, had to strip my bed, had a shower, had an accident. She was wearing pull-ups 24 hours a day. She was wetting the bed constantly. She said to me it took her mind. She felt like she was going to die from it because of the pain she was in. And she says, I don't want to die. But she just couldn't stop.
Sophie had tried ketamine for the first time just a couple of years before. Like many young people, she started using it for fun, with friends. Jacob was one of those friends.
The first time I ever took ket, I'd have been 14. It was typically at parties, things like that. And then it came to a point where it's kind of like I was going through a tough time and I became dependent on it. And kind of like the way I was using it changed from being for fun to cope. And it felt the same for Sophie around the same time. The pain was excruciating. It'd be kidney pain, bladder pain, stomach pain. And I was taking endless painkillers trying to kind of soothe it. And the only thing that would truly get rid of the pain was by taking more. I lied to my friends, I lied to my family. I lost my job. And it was almost hard to remember how life was before it. I was getting through 8, 9, 10 grams a day at the worst point.
And it was just being delivered to your door?
Delivered, going and picking it up, local dealers, it's practically everywhere.
Jacob felt the only way to break free from ketamine was to distance himself from any place and any person connected to it. At the same time, Sophie was also desperate to stop.
She was screaming out for help from doctors, hospitals, but it wasn't helping, nothing was helping. She only got offered detox for, initially it was supposed to be for 11 days, but ended up being 7. To me, I would have wanted her in there for over a month at least to get away, to give her a fighting chance.
Did you believe at that time that she would get there?
100%. When I was a year clean, I sent her a text to say I was a year clean, and a screenshot of this app called I Am Sober. And she said, she was proud of me, and I said, I know you'll get there too. I think she died a few weeks after.
I gave her a kiss and I said, just so beautiful. I love you. I was very proud of her, the person she was. Yeah, I'd never get that day out of my mind.
Unbeknownst to Tracy, just a few streets away, another mum was going through the same thing.
I've actually got a recording she sang when she was 13. The song was actually played at a funeral. I miss everything. I miss the things you'll never do.
Georgia died from ketamine toxicity aged 26. But her mum says when she first used it, she had no idea of the harm it could cause.
She started after a series of traumatic events to sort of numb emotional pain. I think somebody introduced it to her as like an antidepressant. She said to me, "Ket can't kill you, Mum." Probably the last 2 years before she died, she told us that she was addicted to it, that she hated it because of the pain she was in with her bladder. She was in and out of hospital all the time. She used a hot water bottle, and she was taken into hospital, and they found a wound on her tummy where the hot water bottle had leaked, and she hadn't realised because she was under the influence of ketamine.
And she was burnt?
She was burnt.
Injury and illness linked to ketamine use is being seen more and more. But it's not a new drug, and it does have an important role in medicine. In fact, it's been used for decades by both doctors and vets. But more recently, particularly among young people, there's been a big spike in its popularity.
It's huge. I think young people don't understand the severity of what ketamine does to the body. They think it's just a fun party drug that makes you feel a little bit drunk. It's cheap compared to other drugs nowadays. You can get a gram for as little as £10, which is pocket money to most teenagers.
And then there's the role of social media.
You really don't have to look very far to be able to find ketamine being openly advertised for sale. The posts often use code words or emojis and link through to encrypted messaging apps. But we've also heard examples of people buying ketamine on gaming platforms or even getting it delivered with their takeaway.
For how prevalent ketamine is, we're not getting enough young people through the door, which means that there's way more young people that are struggling with bladder problems, struggling with pain, struggling with memory problems, and just the devastation that it causes is huge.
The general trend is a significant increase.
This is Alison Downey. She's a urologist in Barnsley. She tells me how the hospital here is now seeing far more people coming to A&E and to her clinic because of problems with ketamine. How concerned are you from what you're seeing?
The impact that it has on these patients is horrendous. The damage it does to the bladder can, in some cases, be reversible, but in a lot of the cases that we're seeing are at a stage where they're irreversible and causing major issues with pain, frequency of passing urine, and we have patients who've got problems with blockages to their kidneys and needing drainage pipes to manage them. The majority of patients we see are in their late teens or early 20s, but all of them have told me that they've started using a lot earlier, often in school. And whilst I manage patients over the age of 16, I am aware of colleagues treating patients as young as 12 or 13.
And a lot of people will find that shocking to hear.
It is shocking, and it's very frightening, both from the point of view of a urologist that's going to manage these patients later in life, and also as a parent myself.
I take the hot water bottle with me everywhere. I cannot leave the house without it. I must fill it up at least like 15 times a day. It's the only thing that I can use to help ease the pain off me a little bit.
In Lincolnshire, Courtney is in the early stages of recovery from addiction. She says while at first ketamine brought her a sense of escape from emotional turmoil, things quickly changed.
Within about 3 or 4 months, I noticed that my bladder, it wasn't the same as what it was before. I noticed I was going to the toilet quite frequently. My mum took me up to my doctor's surgery and they were just fobbing me off, oh, you probably just got a urine infection. Then my mum started to actually ring the ambulances for me, where they'd take me up to the hospital, and again, they'd just sit me in an A&E waiting room and give me like a 0.5 of Oromorph and then send me back home. But yeah, I knew if I kept sniffing it, it just took everything away. And it was just got me into that vicious cycle where I just completely sniffed it all day, every single day. So I just normally use paracetamols or ibuprofens. I believe I've run out of paracetamols though because I can't find them. It wasn't until this year a specialist in neurology saw me within about 20 minutes, told me that I'm going to be referred to Leicester Hospital to have my bladder removed. But he wants to give me options because there's such things like bladder Botox, one made out your intestines, you know, so he wants to give me them options instead of just removing my bladder and fitting a catheter bag in.
For years, Courtney felt like she was falling through the cracks of a fragmented system, not equipped to deal with the unique realities of ketamine addiction.
Before recently, there wasn't a lot of...
But the Lincolnshire Recovery Partnership is trying to change that.
The big challenge with ketamine in comparison to other drugs is the rate that people deteriorate, that people's physical health deteriorates, that their mental health deteriorates, and it requires early intervention ultimately. So we have to evolve the services that we offer. A big part of that is that sort of joint up collaborative work between substance use services, mental health services and urology, hepatology, to make sure that that person's getting that kind of joint up support.
Across Yorkshire and Lincolnshire, the number of young adults in treatment for ketamine use is more than 5 times higher than it was a decade ago. And our analysis of 18 to 29-year-olds receiving help for any kind of substance use shows that back then, around 1 in every 100 reported a problem with ketamine. Now, it's around 1 in 12.
Was there something that drew you to ketamine?
They're seeing a rapid rise in demand here. So they've created a new ketamine-specific support group and brought in new staff with lived experience.
I remember feeling, when I was a ketamine user, just empty all the time. There wasn't much in terms of a specific ketamine pathway or specific ketamine peer support groups, so that's what I'm kind of trying to bring to the table now for people in my position about 2 years ago.
they understand what I've been through.
But there are fears that those in treatment are only the tip of the iceberg.
There's a big disparity between how many young people are using ketamine and how many people are actually coming in and asking for help. So we're doing a lot of work with the university and going out and doing outreach programs, because I think at the moment it might be a little bit too late when they're coming and the damage to their body is quite severe. But if we could meet people a few years earlier and give them that advice, maybe that less people are going to get to that stage.
Today, the families of Sophie and Georgia are heading to London. Their local MP has arranged for them to meet with the policing minister at the Home Office to share their stories and what they think needs to change. We weren't allowed to film the meeting, but I caught up with them afterwards about what was said.
It's a Class B drug, and if it's a Class A, then it gives the right message to people who are considering doing it.
I think we touched base on everything that we wanted to talk about just educating not only just children but the NHS as well, so they have more of an understanding. It went really well. I felt like she took a real interest in what we were saying. We just hope now that families don't have to go through what we have.
The government is currently looking at whether to make ketamine a Class A drug. Some think that would send a strong message, that it would better reflect its dangers and would be taken more seriously by authorities. Others point out that it was made a Class B in 2014, and yet here we are. They argue that there's no evidence that increasing criminal penalties deters people from using it, and when it's increasingly used in conjunction with other illegal drugs, would its class make a difference? It's a complex question the government is weighing up. But what is clear is that young people need to be aware of what ketamine is capable of. They need access to effective support, and they need to know that there is hope.
Started having PT sessions this year. Now I go to the gym regularly, I go on walks. You know, my lifestyle in general has improved quite a lot. I've tied down a good job. She always wanted to go into care work, and that's kind of the role that I'm doing now. So part of me feels like I'm doing it for her. If I could go back and change it, I would. And if I could change that for someone in the future, then that's the main thing.
I just need parents to be aware that this drug is out there, and young children, young adults are taking it.
For the vast majority of patients, if they stop early enough, actually those symptoms can be reversed. So the earlier that somebody stops, the more chance there is of recovery.
Even if I can help one person prevent getting to the stage that I am, you know, that's more than enough for me. I just won't stop shouting about this till the day that I die. I'm a survivor of ketamine.